Hey there, we're going to talk about abdominal pain today, and we're going to talk about the lower abdominal pain. I am going to draw the abdominal quadrants again. This time we're going to have two diagrams for abdominal quadrants. Okay, so we have the kidneys here. So the first diagnosis will be nephrolithiasis, and then you have appendicitis and diverticulitis, Crohn's, and ulcerative colitis. Next, we have to think about gastroenteritis and inflammatory bowel syndrome and intestinal obstruction. Once you're done here, please remember mesenteric ischemia. Just like we had to remember MI, so here we are remembering mesenteric ischemia. So these are the gastrointestinal and our genitourinary and urinary. Genital we are going to come later. And now the questions that we are going to ask here are just like how we asked previously, food. So it's going to be food first. Is there any relationship with food? Yeah, if you want, you can ask. Fever, just so we don't forget because it's very important. And food, have you eaten anything outside? So when there is E, then there is, have you been exposed to anyone with similar symptoms? And have you been diagnosed with any infections or conditions in the past? Once that's over, then you ask about travel history, and then you have to ask about stool. Here we are going to take a detailed history about stool. Just like for upper abdominal pain, we asked any relationship with food. Here we are going to ask any relationship of pain with bowel movement. And then we are going to ask, have you had any changes in bowel movement? It can be diarrhea or constipation. And then we are going to ask, have you noticed any changes in your stool? So this can be consistency, color, odor. Okay, and next, inconsistency. This is going to be either watery, mucus, fat, and blood. So when you think about blood, you should ask how much amount of blood, and when does it occur. So it is before the stool starts, with the stool, or after the stool. Once you're done with this, we are going to ask here about appendicitis, right? So fever, and then nausea and vomiting, and then Crohn's, ulcers. And we are going to also ask about, there is stool here, so there will be any urinary complaints. So we have to take a detailed history. Have you been diagnosed with urinary tract infections lately? Or do you have any urinary complaints like burning, or change in frequency, or increased frequency, or any urinary discharge? Once this is over, just like last time, the important questions we have to ask over here is sleep, appetite, weight, diet, exercise changes, and fatigue. Diet is very important because a low fiber and a high fat diet can cause diverticulitis. Then we ask about travel, which we've already covered. And here, past medical history and past surgical history is very important because history of past surgical histories can cause intestinal obstruction in adults. Yes. And then we also are going to talk about the genital part of the genitourinary component here. So let's go ahead and draw another abdominal quadrant here. Another diagram of the abdominal quadrants. And we have our female reproductive system. And there you go, the fallopian tube and the ovaries. So here, what can it be? It can be an ovarian cyst. It could be ruptured. It could be a ruptured ovarian cyst, or it can be an ovarian or adnexal torsion. It can be an ectopic pregnancy. Or it can be PID or endometriosis or dysfunctional uterine bleeding. And please don't forget, it can also be normal Mittelschmerz pain that occurs mid-cycle. This is important to remember. Okay, so the important questions here are going to be very easy to remember. We are first going to take the menstrual history. In menstrual history, we are going to ask her when she attained her menarche, and then LMP, and then we ask about the menstrual cycle. So we ask her if her periods are regular. So I write it this way. So she bleeds for 3 days and her periods are regular, occurring every 30 days. And then we ask about the flow. Here we ask how many pads or tampons she's used. And we ask her if it is blood, if the bleeding is medium, low, or heavy bleeding. After this, I like to ask about the blood. If you want to ask, you can ask about the blood, whether she's having just blood in during her menstrual cycle or clots. And then I like to ask about other symptoms here. Other symptoms can be pain, crampy pain in the abdomen, and then you have vaginal discharge, and then you have spotting. Okay, once this is over, I move on to the OBGYN history. I am going to ask her if she has ever been pregnant before, has she has any abortions lately, and how many children does she have. So that is over in this mnemonic GPLA, which we've been using since our graduation. So it's going to be easy to remember. And then I am going to ask her about screening. You can ask her about pap smear. And after that, it's going to be sexual history. Are you active with men, women, or both? And how many partners have you had recently? And do you use contraception? This gives you an idea about PID. That's it. These questions. This is lower abdominal pain for you.